In the past, there's been a huge void in ability for patients with acute soft tissue injuries to access specialist care and to really access care where there's a physician who's experienced in musculoskeletal injuries leading the team to look after that patient. In the past, patients would have to wait months to years to see a specialist for a problem like an ACL tear, for example. And with the Brent Sutter Sports Medicine Clinic, we've dropped that to under 2 weeks. However, in the past, our acute time would be taken up with things like broken bones, life-threatening infections, and soft tissue injuries would get pushed to the end of the list. However, we noticed that over time, patients would have worsening outcomes the longer they waited to seek health care for their soft tissue injuries. And so we decided that if we could see patients early, they would have better outcomes. And so we changed how we do many things at our clinic. We hired more surgeons, we changed how we provide call coverage to the hospital, and this allowed us to free up time to see acute musculoskeletal injuries on a rapid basis. And the surgery part, honestly, is a small component of it. Not all of these patients go on to surgery. Some of these patients just need to see an advanced practice physiotherapist who works side by side with a musculoskeletal specialist, such as a sports medicine primary care physician or an orthopedic surgeon. And together with the patient, we can decide on the appropriate care pathway. And that sometimes comes to surgery. And when that happens, we're able to triage patients to fix acute problems acutely. And sometimes it just means bracing, physiotherapy, exercise prescriptions, the permission for a patient to return to activity. So we're able to do either a small surgery now, which has a faster recovery time, as opposed to a larger surgery later, which has a longer recovery time. Or we can intervene with appropriate bracing, physiotherapy, and education to prevent the need for surgery altogether.